Welcome to Be the Category of One. I'm Jenn Brown, leadership coach and COO. This podcast is about growth, mindset, and leading the way by choosing to stand apart in how you think, how you lead, and how you serve. Welcome, Michelle. I'm so excited to have you here on episode 2.
Thank you for having me. This is exciting.
Something new.
Yeah.
How did you survive the snow?
Not very well. It's a lot. It has me rethinking all of my decisions to live on Long Island during the winter. So, I'm actually fantasizing about that beach house or that being a snowbird. That's now become my ultimate goal right now, is to figure out how I'm going to be a snowbird, because I need to fly away when it snows like this.
It's definitely not fun. I was on vacation and I had to come back a little later. But I had that decision of, should I extend it past the snow and come back much later? I decided to come back a little bit before it, but ride it out with friends, which was great because I wasn't expected to. I was guest, so I wasn't expected to shovel. So it was still like an extension of vacation. But I was down in Florida, and the whole time I just kept saying to everyone who lives in Florida, I'm like, this is a lifestyle enhancement. Now I get it. And, like back in the day, I was always like, my mother-in-law was in Florida. It's not the place for my spirit. It's a little too soon. But now, coming back to it, it was insane.
It was. Lucky for me, I have my husband and my 2 grown sons. They did all the shoveling. They had to do it in shifts. I was in the house making comfort food. I had the snacks ready. So,
dogs?
He's not a fan of the snow, so he kind of just hid there. And if we had to take him outside, he just didn't know what to do with himself. He was like, it's cold. I want to come back in.
They're done with it.
Yeah.
They're done with it. Welcome, Michelle Sands. You are our Airway Health Department lead, and you've been doing some really amazing things, especially over the last 6 months, I'm going to say. I'm very excited about this department's growth and where we're going. So why don't you tell us a little bit about your journey with Babylon Dental Care, what you're doing, what excites you now that we're embracing? Give us the long version of everything.
The long version? All right. So once upon a time, I've been with Babylon Dental Care for, I think it's 15 years.
Is it that long?
This is 15 years this year.
That's insane.
I started with Babylon Dental Care as an experienced hygienist. I've been doing, I'm a registered hygienist for over 30 years. I don't want to date myself or age myself, but yeah. And so I practice chairside. I've done many different roles with Babylon Dental Care, leadership roles, training roles. And I was enjoying my career as a hygienist, although it's very physically taxing, and the hygienists out there know. So I was looking.
I've had a few sprinklings of, hey, can we talk about some other opportunities?
Yeah,
it's exhausting.
Every hygienist reaches
physically.
a point in her career or his career where at some point you have to start rethinking what your long-term options are, because it is physically demanding. But as I was thinking of those, what would my options be? I was trying to figure out, do I want to do consulting? Do I want to do something different? And there was divine intervention, is what I call it. Basically, I was blindsided with a breast cancer diagnosis, and then I was forced to make my decisions. I needed to stop practicing chairside hygiene immediately and get right into treatment.
By the way, while your experience was definitely horrible for you to go through, we all got blindsided because we were at a leadership retreat in Long Beach, and you got the phone call, which I couldn't even imagine. I remember lecturing at that point. We had started the morning, and you got a phone call, and you got up, and my heart sank, because I know that's not like you to get up like that.
Yeah.
And then when you came back, I mean, the room, we had to take a long pause. We were all blown away.
You know what? I can honestly say there are only bits and pieces that I remember in that moment. I remember you had these beautiful floral arrangements, and I had just gotten the phone call, and I had the support of one of my other hygienists, who's a dear friend, Jackie Cooper, who is our clinical director. She was there with me, and she knew I was expecting test results. She sat, she held my hand, and she asked me if I was good to go back in the room. And I was like, yeah, I kind of didn't know what to do in that moment. That's just a moment where life stops completely. And, you're not even thinking. You're just...
And this was a routine mammo, right? If I remember correctly.
This was actually a follow-up after a routine mammo that was negative. And I had felt a lump, and I went back, and my doctor was like, oh, the mammo was clear. You're fine. But I didn't feel fine. Even though it was small, I was listening to my body. And I went to my gynecologist, and I'd had her look at it. And she said, no, let's take a further look at this. And she ordered biopsy testing. And I'm glad she did, because the biopsy came out positive for breast cancer. And it also came out positive for breast cancer spread into my lymph nodes, which that was really the big blind side. So, one of those phone calls that I took that morning was actually from her. As soon as the lab test came back and I got the results, this next phone call was from that doctor saying to me, I'm so sorry, you're gonna get through this. And I just wanted you to know that I'm there to, if you need me. And at the time, I'm only remembering that now as I'm speaking with you. But at the time, it's like there was so much going on, and we were a little far from home. And so I went back
you're
into
over an hour away. I remember
Yeah.
that, yeah.
I went back into this room and then sat with the whole leadership team. And, you were doing your presentation, and all I could focus on was these beautiful floral arrangements. And I remember them distinctly. Alyssa had made them up. They were absolutely gorgeous. And then I was like, what am I doing? I have to do something. I have to act. And I said, I'm sorry, I had to leave. And I got up and I walked out, and I went to get my car. The amount of support that followed me out of that room in that moment was incredible. Sally came out, you came out, Jackie came out. Everybody was like, oh, we're going to, get you the help that you need. Here's the doctor. I'll never forget that moment. And it was, people really showed up for me in that moment. It was, very powerful for me when I think back at it on that time. I drove home. It was an over an hour drive. Don't remember any of it. I don't even know how I got home. I got into the car and I just went home. And then it was, now what? What do I do? And fortunately, I had an incredible team of doctors that helped me through that. And I am looking at this year, 5 years cancer-free.
That's beautiful.
And
I can't believe it's been that long. It's great.
It seems so far away from me now, but it's definitely a day-to-day
But just reliving it, I feel it like it just happened.
Yeah, absolutely. Even just talking about it.
Yeah.
It gets very emotional, very tense. That's something that's the kind of news that you don't know how to react to that.
No. And one
you
thing,
can't plan for it.
One thing on our end that was really telling about you as a person and meaningful for us working with you as fellow women in a professional space was how strong you were from the moment. We felt how you felt. We could imagine how you were feeling in that moment in Long Beach, but you, from that moment forward, you were so strong. You were always forging forward, finding what was next, this is the next step, and then this is the next step, and then this, and it was really inspiring because I don't know how I would handle it in my own situation. And the other thing that I think back on, and especially now that we're chatting about it, is how beautiful our team is. That
Yes.
everybody came around you, and from that moment forward, again, you were handed a card that you couldn't return to hygiene, yet we immediately went into the space of, but you do this and you do this, and this is great for you. We
Yeah.
all were coming together to figure out what would be your next professional step, you know,
Well,
with the circumstance that you were given.
it was definitely, I had a lot of wonderful support, and thank you. And to the whole team,
course.
it's something I will never forget for the rest of my life. And, when you talk about being strong, you don't really know how strong you are until you have no other choice but
Right.
to be strong.
Right.
And, to make decisions like that. It was the unknown. It was not having a plan. And the biggest thing for me going through the entire treatment was not being in control and trusting others to take care of me.
Yeah,
and
I get that.
That was hard. That
Right.
was something that I had to learn
That's
to
a
do.
lean in. That's a tough
Yeah.
lean in. Yeah.
So there were great life lessons that I got out of this. And on the other side of it now, it has really shown me a different path that I am absolutely loving and enjoying. So when I couldn't practice chairside hygiene, what did I do? Well, it just so happened that Dr. Brown, who's been practicing dental sleep medicine with the practice, who I always had a great interest for that. I mean, I was always like, wow, I can't believe he's bringing this in. He's a genius. He's seeing this need way before it's becoming a thing, which now sleep, it's a thing. It's everything. It's all over the place. It's who's not sleeping, how you're feeling. There's so many products now that people are investing in. But back then, he said, "Hey, why don't you come over and run my sleep department for me?" And you presented me with that, and I was like, "Okay, yeah, I'll do that." I had no idea what it took to run a sleep department, to be a director of any department. And, I had a vague idea of dental sleep medicine, but there was a lot to learn. So that was something that was, for me, fulfilling and enjoyable, learning something new. And it was occupying my mind while I was going through this really tough treatment. It gave me a place to go, showed up every day through chemo, radiation, before and after surgery, through physical therapy. I went to work. I don't think I actually missed work until I had to when I was out for my big surgery. And it just made everything easier for me to get through all of that. And at all that time, I was learning and growing and developing and keeping my mind occupied, which was huge. I learned a lot along the way, learning dental sleep medicine and connecting the dots between treatment options and symptoms and where is this all coming from, attending so many symposiums and continuing education seminars. I started to piece together things. And I remember sitting in a symposium in Florida, and we were sitting at a table on a break, and it was mostly dentists. And here I am, a hygienist, sleep department director, and I'm sitting next to dentists from other states. And we had just heard one dental sleep medicine doctor talk about tongue ties and is your office looking for this? I'm a hygienist for 30-something years. And I'm like, what do you mean? Are they looking for tongue ties? Tongue ties are obvious, aren't they? And they don't teach you these things in school. But there's many different evaluations for a tongue tie. It's not that traditional. You can't lift your tongue because the tip of your tongue is tied down. And learning about how that affects your airway and your breathing and your sleep. And I remember this dentist sitting to the right of me, and she looked at me and she's like, "You should become a myofunctional therapist. We need them out there. there's not enough of myofunctional therapists out there. And I was like, what exactly is a myofunctional therapist? I didn't really know. And, I started going online, educating myself, and attending webinars, getting little tidbits and pieces. And then finally I was like, oh my gosh, this is it. This is the answer to why are all these people having so many problems with snoring, sleep disordered breathing, mouth breathing. It all ties into the muscle function. And that's what led me to myofunctional therapy. And I made an investment in training and becoming a myofunctional therapist. And right now, that's where I am. I'm retired chairside hygiene for 5 years. I'm focused on airway health, sleep medicine, and myofunctional therapy.
So I remember the journey. I remember when he came home, Cliff, and was like, I want to do this. And at the same time, he was also becoming certified for oral sedation. So I was like, okay, he's expanding his career. It was exciting. But at that point, I was the marketing director. And I think I was telling Angela this last podcast, I got tasked with building out the website. And at that point, I was using a web company that wasn't in the dental space. But even in the dental space, no one there. I mean, at that point, we were dealing with Guy Yatros, and I don't even
Right.
think his website had really any information on it that I could even glean. So it was like, go out. So literally, he's handing me pamphlets
Yeah,
from every
there
event
was
he went
no
to, and
AI.
I'm high. No AI,
Yeah.
no internet. I now watch TV, researching and watching the Carolyn Bessette. I'm obsessed because I read the biography a year ago, but I'm watching it, and everything that pops in, I'm Googling, what were the name of her black glasses, or who was she from? I'm what was the restaurant that they went to? But I'm not even watching TV. I'm Googling the
Right.
answers to what I'm seeing on the TV. It's insane. So got that up and loaded. Then, but at that point, it was very snore related.
Yes.
It was almost like you snore, you have sleep apnea. Like the snoring was the first tick into that space of conversation. But I remember the marketing messages were so sensitive at the time because no one would admit to it, because it
Yes.
was like a bad thing to admit to.
Yeah.
Like, like you're taking something you shouldn't take, or you have something you shouldn't discuss. It was insane. So we had to do these funny spins on, snoring, because that
Yes.
was the only messaging that I could get that would be fun enough for someone to pay attention. Because the moment you said sleep apnea or OSA, oral sleep,
Yes.
they shut it right down. Everyone shut it down. And then it was really interesting because before COVID, and I think it was in 19, I got invited by the MTA to attend a conference they had where vendors were coming to put in contracts to be their OSA treatment option for their MTA workers, because of all of the accidents that were happening at night with conductors falling asleep driving the trains.
Yes.
So I went to that. I was the only person who represented a dentist. Everyone at that point were major hospitals that either had big sleep wings or building sleep wings. And then all the pulmonologists, who were the gold standard, is the CPAP. And at that point, the messaging started shifting into CPAP intolerance. And I coined the phrase, see it a CPAP, because that was another way that I could get in front of an audience that was suffering. Because again, no one was holding space for sleep issues except for the wives complaining about the noise
Yes.
their husbands were making. So that was the only space I can get in front of messaging wise. And then the second was people sleeping with a CPAP. And at that point, on Modern Family, an episode had just recently broken with him in the mask.
Yes.
And truthfully, there wasn't even a lot of images out there that I could use for marketing.
Isn't it amazing how that machine, the way it looks, that there's so few images of what it's like to
Be-
actually have that on your
I'm
face.
telling you, I feel like it has always been a situation where it's lobbyists who
it's like a secret.
make the machine, and all the insurance companies pushing them right into. And at that point, I think the machine was $5,000 to $10,000, something ridiculous. You know, again, pushing sleep labs for 5 to 10,
Yes.
then pushing. It was such a hard space to break into. And again, it was one of those things like him doing oral sedation where it was a side offering. So if he was treating a patient that he had a relationship with that was suffering, he could potentially talk to them about this non-invasive option. But I could not market for, you know, and Cliff has always been a big marketer. He always wants his name, the practice's name out there, the practice branded. I couldn't get any traction at all in that space because most people just didn't want to hear about it.
Down. At the moment you say the word apnea, and this is going back, that's why I'm saying, like, he was genius, because we're talking about how many years ago was this, Jen?
I know. Well,
where he was thinking of this.
Yeah, I mean, yeah, it really started forming in 1819. And then I remember when we made the commitment to separate the websites, because that was the other thing. Like, why do we have another website? We had another website because the moment someone saw it was a dental website or a dental practice,
Yes,
they shut off
they
to the
shut it
sleep
off.
messaging. So it was like I couldn't win. It was so hard to get anything going. But so we go down that path. Then COVID hit.
Game changer for
Huge.
sleep
Huge.
testing, sleep apnea, total game changer.
Huge.
Now people are locked
Two
in
things.
their homes.
Lots of babies and people who didn't sleep.
Yes, they don't sleep. They're not working. They're not sleeping
Well,
now.
they're
there's no
dealing
place to
they're
go.
dealing with the spouse snoring and making noise all night, and then they can't escape and curse the spouse out all day to recover from the night not sleeping. Now they're forced to have to actually be with that person 24/7.
Yeah.
So that was the biggest, and then again, I don't know what happened in I'll call it the industry during that time, but more and more, and you know, again, the tongue tie situation that I'm now hearing about, and the myofunctional. While I'm no longer the marketing director, my marketing director is constantly oozing nuggets about tongue ties and all this stuff now. But now I'm out. What I always do, right? How many people have I sent you? I'm out there talking about it.
Yeah.
I can't believe how many kids, young children. Oh, I had it cut. And I was in education for years, and I didn't realize what an issue it is for speech.
It's an issue for
Blown
speech.
away.
It's an issue with sleep for the kids. You know, if your child is sleeping with their mouth open, snoring, even if it's just light snoring or no snoring with their mouth open, there's an issue. There's an airway issue that needs to be addressed, that needs to be looked into, because it's going to impair how that child's facial and bone structure actually develops.
That when you said that the other night when we were at dinner, that actually freaked me out.
Yeah. Children that are going undiagnosed that have these issues that either they're only showing up in small increments that parents think, oh, yeah, it's normal. It's normal. Or, you know, oh, it's normal that he has ADHD. He's a boy. Or
He's just very quiet.
yeah, you know, oh, they're just not a good sleeper. Those are issues that need to be looked into further, because if it's an airway issue, if they can't breathe through their nose, if they have a tongue tie and their mouth breathing, if they have a low tongue rest posture, if they're sleeping in weird positions because their airway is collapsing when they're sleeping in traditional positions, so they tend to like sleep in these really weird, strange positions that parents may think, oh, that's cute, let me take a picture of that. It's a sign that this child may be struggling to breathe. And if it's not caught early enough and development keeps continuing, what ends up happening is the face starts developing longer, the mouth, the chin more receded, forward headrest posture, because this is the body learning how to compensate when the muscle function isn't performing the way it should, because you need to breathe. Whether you can breathe through your nose, you breathe through your mouth, you need to breathe. So in our practice, where we have a full team, pediatric dentists, hygienists who I've personally shown them things that I know that we weren't educated in school, to so that they're able to recognize this when they're looking into a patient's mouth 40 minutes, 60 minutes at a time. We're looking right down into the patient's airway and recognizing the signs that that person may be struggling or that child may be struggling, and knowing that we can help, that we offer those services. I mean, it's important. Our pediatric dentist is now intervening and having conversations with the parents. And sometimes they're tough conversations because the parent's not ready to hear that yet.
Right. Yeah, well, that's what I keep in playing in my mind as you're speaking. I don't want to interrupt, but why is this not part of the routine exam and brought up, now that I remember when I started, we weren't doing oral cancer screenings.
Yes.
That's now part of the routine exam. We're now doing sleep evaluations. That's part of a routine, exam. Why is this not, even for adults, not part of the routine exam? Because it's like almost like the parent has to noodle around and figure out that there's an issue. Again, all the signs can be, as a parent, if went to my mother about all this stuff, she's going to be like, oh, you were never a sleeper. Oh, you slept contorted too. You had a blanket and, all of the things that I would bring to her, she would tell me I did the same thing. So I would not even continue to look for the answer.
Right.
So why is this not part of routine exams?
That's an excellent question. All I can say is I know it is at Babylon Dental Care. It should be everywhere. There's just not enough education yet out there. And sometimes healthcare providers, hygienists, dentists, they have to seek out further education in this. There may be a mention of it in a lesson plan you're in school.
So I come in for hygiene. They're going to tell me, by the way, Jen, did you ever know? And I'm not going to say anything about my sleeping. By the way, Jen, did you know that you have a tongue tie?
Oh, absolutely.
Okay.
So hygienists cannot diagnose a tongue tie, but they can recognize a tongue restriction.
Okay.
And have a deeper conversation with that patient. And if we need to, we can always refer them to a specialist who can indeed evaluate that and say, hey, yes, this is a tongue tie. It is restricting movement. It is impairing your function, and it should be addressed.
Right. I know we're in talks right now about getting a laser in, and our periodontist possibly, is it removing the tongue tie? What would that be called? Or corrective?
Releasing it.
Releasing it.
It's tethered oral tissue restrictions, and you release that. It could be a tongue tie. It could be a lip tie. Basically, it's impairing how the muscles are moving, and it's preventing the tongue to get into its full rest position. By the way, 30-something years in hygiene, I had no idea. A tongue's full, proper rest position when you're not speaking, chewing, eating should be in the roof of your mouth from the tip to the tail, naturally in the roof of your mouth. So
I'm trying to figure that out. Say that again.
Entire body
roof
of
for
the
the
tongue,
mouth.
from the tip to the tail.
Okay.
That's what I say to the patients. From the tip to the tail, your tongue should be resting in the roof of your mouth when it's not being used for speech, for eating, for chewing, for swallowing. That's where it should be. So a tongue restriction keeps the tongue low, and sometimes only part of the tongue can get into the proper position, not the full body of the tongue. So when that happens, the body learns to compensate and develop around the restriction. And so the muscle function changes. Instead of when you swallow, you're making a full wave into the roof of the mouth from the front to the back. With that restriction being low, the tongue and the facial muscles, the lips, the neck, learn to make a forward motion, down and forward. What happens is all of these other muscles now are being used to form a swallow, where a swallow should happen naturally without many other muscle movements. And if you think about how many times a day we swallow, it's like thousands of times a day. For somebody who is compensating all day long, they're using muscles like this, and they start to develop other issues and symptoms. TMJ, pain, clenching, discomfort, forward neck, headrest posture where there's a tightness in the back of the neck and the shoulders. All of this is stemming from a tongue restriction, which may be caused by that tongue tie. That little tiny piece of string completely changes how the patterns for function
So,
happen.
so that sounds like that's a lot. And probably most of us have that going on and don't even realize
A
it.
lot, yeah.
What does it do for sleep, though? Is it
So-
similar?
Very similar. So, being that this is not something that was well known by healthcare providers or looked for by doctors, dentists until more recently, tongue tie shows up in different stages in life. First, as an infant, when the baby can't suckle, they'll address that tongue tie. Then, maybe in school, where there's sleep behavior issues or speech issues, they'll evaluate again for a tongue tie. And if it goes unevaluated and you're an adult now and it'll show up one more time in the form of sleep apnea or sleep disordered breathing or maybe snoring, and you've been struggling your whole life about it and nobody's spoken to you about it, and when you come to us, we kind of show you. I give the patient a mirror and I show them exactly what we're looking at and talk to them about, hey, here's where you are, here's where you should be. And for a lot of people, it's like, what? How am I this old and nobody ever talked to me
Well,
about
I'm just
this?
thinking like, so
Yeah.
think about, I'm just going back to sleep apnea and the diagnosis. So if your general provider, your GP, right, refers you to a pulmonologist to get tested, the pulmonologist is going to push you into a CPAP, right? Which is just pushing air into you. But would a pulmonologist even look in your mouth to see if there is a tongue tie? Would they address that along with the
I can't speak for the pulmonologist. I'm going to say a lot of patients that come to us that come from having a pulmonologist evaluate them, they've done the gold standard, they've tried the route that they're supposed to, they've followed everything, all the recommendations, and they're still having problems and they can't tolerate that CPAP. A lot of times we're the first that tells them, hey, have you ever noticed you have a low tongue rest posture? Have you ever noticed you have a tongue thrust? Have you ever noticed that you have a tongue restriction? And a lot of them, I had somebody just last week that she's couldn't tolerate her CPAP and her daughter's getting married. And she wants to do orthodontic work to broaden her smile and, she's very crowded. And I put the mirror in front of her and I said, here's what I see. The crowding, she doesn't have enough tongue rest space. She has a tongue tie. She has a forward swallow. She has a tongue thrust. All of these things. And she looked at me. She was like, how come nobody ever told me this before? And I said, all I know is this is newer information now that we're sharing with our patients. I didn't always know this, but I do know what I'm seeing and
I
how
don't
we can
ever,
help.
in all that research, really never read anything about tongue thrust
No.
because it was never on the site. We
No.
just recently,
That comes up.
and I can't even find images of what you're talking about, that look.
Yeah.
In any medical formats, I can't find any images for
There's
marketing
not
purposes.
many images unless you're treating a patient and you see them from start to
Right.
finish.
But
Most of
no
those
one's releasing that. They're not out
nobody's
there.
releasing it. No,
Yeah.
there's like these one or two standard images, and most of them are like illustrations
Yeah, yeah.
of how your child will develop. And some of it may be a little exaggerated, but hey, I mean, it follows a pattern. And I'm seeing many, many adults suffering from sleep apnea that is exactly how they developed. Forward
Interesting.
headrest
This was
posture.
very
And
interesting.
they're coming in because they're clenching, because they're grinding. They need a night guard. They're having pain in the facial muscles. They also have neck and shoulder pain. They are exhausted. They're mouth breathing. Mouth breathing is an exhausted form of breathing. It's exhausting. Your body's not meant to mouth breathe.
I've been doing it recently because I've been congested since probably November. Oh my God.
Yeah.
I'm so uncomfortable when I first wake up and deal with the dryness. And I could tell my jaw, it's a very uncomfortable feeling. And you're just not even, I mean,
No.
when you're, when you're getting up to grab water because you're that uncomfortable, I'm also in those, whatever, beautiful time of my life. And I know that's also part of it, but
Yeah.
literally I'm dying to get water because I can't. I'm just so
Yeah.
dry. It's ridiculous.
Absolutely. So we're seeing a lot of patients come to us that are having those same issues. And when we look, hey, it's muscle compensation. There's a lot more going on, and nobody's talking about it. And, you mentioned you're at that age where your sleep may be compromised. Sometimes that's not everything. There's more to that picture. It's not always all hormonal. So, I mean, I think everybody can benefit from having an airway evaluation to see if their muscles are not functioning properly, to see if symptoms that they've been dealing with and treating, like all of the things like the CPAP, that's treating a symptom of a bigger cause. The root cause is the airway. You have to treat the airway. It's the muscle
And again, when you say
impairment.
it's not treating it, it's because it's just forcing air through the airway.
The-
It's not opening the airway.
Let me correct that. The root cause of everything that patients are suffering these symptoms from is muscle function. You have to correct the muscle function and teach the muscles what they're supposed to be doing. That's the tongue, the lips, the muscles that control nasal breathing, proper tongue rest posture, swallowing. You teach the muscles what to do properly. It tones the muscles, and you see improvement in a lot of these symptoms. So you're correcting compensations that has the body making stressful movements all day long,
Straining itself.
straining itself. And that's what I do now with myofunctional therapy. And obviously, I'm loving it. I'm passionate about it now, recognizing that for patients and offering them a path into treatment, and just putting the pieces together, because so many people look at me and they go, "Oh my God, how did you know that? How
Yeah.
did you know I have these symptoms?" I can see.
This is a whole new cutting edge
Oh,
piece
yeah.
to airway health
I,
that really is going to probably in another year become,
I think so.
the
I
norm.
honestly think so.
Like a lot of my friends and a lot of like my mother's friends, and I was saying this one before we started, having surgery, getting their joints replaced. Next thing they do, right after they're cleared, PT. And then they're rebuilding their muscles
Yep.
and their movements and all of that through PT. So basically, in my mind, this is very similar.
Oh yeah. There's definitely this is like physical therapy for the muscles that control the airway. So that's a really simplified way of talking about myofunctional therapy. It's physical therapy for the muscles that control your airway, to promote better nasal breathing, lip seal, proper tongue rest posture, proper swallowing. Everything else kind of falls in line when you target the muscles and you teach them how to work properly. With the physical therapy part, now with social media and you saying this is becoming very more mainstream, this younger generation, they are on it when it comes to healthcare. They know things. They are putting videos and everything out there. There's like clips and exercises for snoring and sleep apnea and all kinds of things.
Mouth tape.
There's the mouth tape. Oh, I love that. The mouth tape, that big glob of tape that goes over the mouth and almost suffocates you. What a myofunctional therapist does is a myofunctional therapist is there to guide you to your specific needs. This is not a generic thing you can go online and say, oh, okay, I'm going to do these exercises and that's going to correct what's going on. That's almost like
Listen,
going to
I've
gym.
been doing, I was just going to say,
Yeah.
I've been doing the same exercise. I won't even say her name to get this girl's ass, and I cannot, no matter what I do, those exercises are not going to give me that ass.
No, and I was just going to say, it's like going to the gym and working out and using equipment or doing exercises, but not having that person that has the knowledge to know
Yeah,
what needs to be
I get it.
fixed.
I've been one of those people.
Yeah.
I've been one of those people for a very long time.
Right. And,
Chasing whatever I see in someone else, thinking if I do the same thing, it's going to happen. It's just it's never going to happen.
right.
I want to go back though, because we jumped right into what I was dying to talk to you about. But I just really want to go real quick on the steps of, how we at Babylon Dental Care and Silent Night Therapy treat from the screener through to the diagnosis, to the actual treatment, and the blending of different, I'll call it modalities of treatment, right? Just real quick, high level of the steps that are involved and what a patient might go through with us to get the care that they need.
So the biggest thing I can say is it's collaborative care. It's not just one person, it's a team of people, and we work together. So a hygienist that is trained to recognize these symptoms would screen a patient as part of their routine hygiene visit.
But I'm going to pause you. We have plenty of patients, though, are not on the dental side of our practice that come straight in to Silent Night Therapy to be treated. So we interact with patients at the start of their
Yes.
care journey in two different spaces. One are patients that come to us as treating with other dentists or other practitioners, and then we do a screening for our own hygiene patients, right? Every
Yes.
year.
So when I say collaborative care, it's in-house and outside of our own practice as well.
Okay.
Our personal experience is our existing patient base are all screened for airway disorders. And the hygienists know how to have those skilled conversations and encourage them to have a consultation and make sure there isn't an underlying airway issue. We offer home sleep testing options. Like we were talking about earlier, COVID's a game changer. The lab shut down. Nobody can get a sleep study. The industry had to shift. And post-COVID, nobody wants to do a lab test unless if they actually have to. The technology, including now with AI, we just attended a symposium last month or the beginning of this month, and we had numerous sleep physicians talk to us about how AI is making the home sleep testings on the same level as the lab sleep tests, the results, the reports. And it keeps getting better and it keeps changing. So now patient can do a sleep study in their own bed, simple device. Some of them pair with apps, some of them don't. You just put it on, you use it and follow directions and the report generates.
I know you tested my dad. I don't want to HIPAA violate, but whatever, let him sue me. He calls me up. He's like, I can't get it's got to pay. Like, it was a technology piece. I said,
love
Daddy,
your dad.
I said, Daddy, you have two options. You either call her and let her write down everything she says. I said, you have two options. You can either do this with Michelle, write down the steps, or you're going to go to some strange sleep lab and sleep. How are you going to sleep? He's like, what do you mean? I said, they're going to watch you all night. He's like, I can't do that. I said, so ask her to give it to you. That's the biggest.
Right.
And now, P.S., years ago when we were treating and we would recommend a sleep lab,
So basically, we guide the patient through it. Like, specifically your dad was one of those patients. He needed that extra help, and we're fine. Our team will guide you
no,
through
you guys,
anything.
and it's, I know, you know what I like? I know you're not doing it just for my dad, because
No.
I've heard it from other people, in trying to speak with people about what we
Yeah.
do. You're like that with everyone. I know that.
A lot with us with sleep apnea, snoring. We see a lot of retired people, and they're not as tech savvy, and they need help. They don't know how to download an app. They don't know how to open the app. They don't even know their password. when we get
Oh,
them to the
I
point where
know.
we're going to download the app,
I have their passwords on
and
my
it's
phone.
password protected,
I
and
know.
they don't know their password, but we're here to help. And they come into the office and we sit with them. We have
I
a great Airway Health team right now.
You do.
And
Very blessed.
it's whatever it takes to get the patient the help that they need. So going back to what the process is, whether they're coming from our screenings in the office or they're being referred by ENTs, pulmonologists, we're getting referrals from other dentists,
a lot of
other
dentists. I'm
dentists
seeing a lot
who's
from general practitioners. So,
they
yep.
know that there's a dental sleep medicine option. They were just never trained in it, so they send them our way. We're even seeing referrals from ophthalmologists, believe it or not.
Interesting.
They're diagnosing sleep apnea from lazy eye syndrome, lazy eyelids. And the first time that this happened, I looked at Dr. Brown. I was like, oh, have you ever heard of this? We need to know more. And we've been even there on top of diagnosing our
Wow,
patients.
that's wild.
My husband went for his physical, and the doctor says, how's your sleep? He looked at him and he's like, my sleep is fine. My wife tested me and I'm treated. I'm okay. But he came home and he's like, that's the first time he's ever asked me that question.
Right,
Because
right.
it's becoming more mainstream. And now CPAP's not the only option. We collaborate with a lot of great ENTs and even pulmonologists who in the past were CPAP's a gold standard, who now know that patients are getting great results by using a sleep appliance, a mandibular advancement appliance. And now we're adding in the myofunctional therapy option where you can get treated for the apnea or the airway disorder, whether it's snoring or full sleep apnea. And then let's take it a step further. Let's address the root cause. Let's work on that muscle function. Let's correct those impairments and let's get even better results. It's not only one thing, it's a lot of different things. And that might mean that that patient has to see an ENT because they can't physically breathe through their nose. They may need to have a tonsil evaluation. They may need to have a tongue restriction evaluation. Whatever it is collaborative care. And now we're offering these services to all of our patients, whether it's a child or whether it's an adult coming to see us for sleep apnea or snoring. With children, now we're able to say, hey, we've noticed that there's an airway restriction because there's very enlarged tonsils. How are they sleeping? Are they mouth breathing? How, having bigger conversations, sometimes the parents aren't ready to hear it, but introducing it, and they may hear it on another level. So we've said it to them, and they're not ready to move forward. They go see their doctor, or the child's having chronic ear infections, chronic tonsillitis, and somebody says it again, and then it just strikes. Oh yeah.
Oh, I believe they're looking at their videos a little differently after speaking to you. I'm
I
sure.
hope so. I mean, this isn't something that's mainstream, like get the word out,
No, it's not.
but
But when you start talking about it, you do hear a
yeah.
lot of people that are addressing it. So again, we get a patient in, we do a screening. That's the ring, right? It's as simple as the ring. That's what
We have a couple of options. So for patients who aren't ready to move forward with a diagnostic test, we do have equipment in the office to screen patients and offer them the opportunity. Hey, I have a testing device. Why don't you take this home, sleep with it for 1 or 2 nights, bring it back, and we'll see what the report shows. Now, the report with this device is a very detailed report. It shows apneas, it shows REM sleep, it shows oxygen desaturations, it shows hypoxic burden. That's another new trendy thing that it is an indication, according to the doctors that we just heard at the symposium, hypoxic burden is an indicator for future disease. When hypoxic burden percentage goes over a certain amount, I believe it's 20%, that patient is at risk for future disease, cardiac disease, Alzheimer's, dementia, things like that. They're using this. This is an AI thing, I believe that's how it was spoken about, that now these reports can predict future disease. And this is something that we have available, this technology in our office. And we're going to use that to screen the patients. And if we do get this report, we're going to say, hey, look, this is showing that there is an airway disordered breathing condition that needs to be addressed. Let's move to a diagnostic test and get you into treatment.
And the screener, I believe I heard you say it's about $40.
It's $40
Rental.
just to take it home. You know, you borrow the equipment from us, and you bring it right back. It doesn't require any download of an app. It is literally a ring you slip on your finger and you go to sleep.
Great. Okay.
Yeah.
So then diagnosis, that's a different test.
Diagnosis is a different test.
Still a
So
take home.
yes, this is going to be a home sleep study. We partner with an outside testing company that does virtual health, and they will do a virtual visit. You do a virtual visit with an airway physician, a sleep specialist, a sleep physician, and talk about symptoms, what brings you to getting tested, and then you take the test.
Not to go back to cost, but what does this cost?
This, most of the time, is covered under medical insurance.
Medical, not dental.
Medical, not dental. At right now, the rate is under $275 to do it if you were paying full cash. So relatively
And we've had
inexpensive.
patients do that.
Oh yeah, relatively inexpensive. You know, there are patients. I mean, we can't let our insurance benefits and our health care dictate the treatment that we need.
I just had to pay $300 to get home for my extra weight on
Don't
the
even go
bag.
there. Don't even go there.
300. I
Yeah,
could have had a diagnostic.
Yeah, I know. And, you know, this is something where patients, I mean, yes, it's expensive to live with inflation, with cost of.
But you know,
This
when
is
you
your
think
health.
about,
This is
when
your
you talk
health.
about relative to the other things that we find ourselves spending money on, 275 to wake up not all distorted is
Yeah.
just a great
Absolutely. I mean,
value for me. I don't know.
that is an investment in your health.
Right.
And that's a very small investment to get answers to a very big problem. You know, I have a different perspective when it comes to health for me because of what I've been through. Healthcare has to be a priority, and there's no price that you can pay to be well. And believe me, I've had challenges having to go through very difficult and expensive treatment. I was very fortunate and very lucky. But if somebody would have said to me, oh, you know, it's only $207, maybe then I would have said, oh, do I really need to do this? Now I know how important it is to make sure that your health isn't impaired at all. So, I
Right.
mean, this is an investment in you.
So we get the diagnosis and we're still on track.
Yes.
There's sleep apnea present, right?
Now we're going to offer treatment options. Treatment options may be depending on what the test results. We look at the test results always to determine what would be the best place for that patient to start.
And patients come back in.
Oh, yes, they're going
Okay.
to come back in. We're going to sit down and we're going to review in detail what the report shows. The testing company we use, their health providers also will review with that patient as second video visit all of the results and talk about treatment recommendations. Now, when patient comes back to us, I want to know sleep test results, and then I want to know honestly how well they would tolerate whatever treatment we're recommending.
Yeah,
I
like
can say to you,
your lifestyle. What's
Yeah.
their lifestyle like? I mean, do we have patients that really opt to go CPAP?
we do. We do. There are patients that are very, very severe with oxygen desaturations, or even the mild or moderate, and their oxygen desaturation shows something,
Oh,
or
because
the
of the
hypoxic.
results. But I'm talking
Yeah.
choice. By choice,
Choice-wise, we're
would
going to
people-
always recommend what's in their best interest. So maybe a CPAP, and if that's what it is, we'll refer them out and say, hey, if you're struggling, you can come back. So now with the myofunctional therapy, it could be a CPAP with the option to add myofunctional therapy into this. Let's work on those airway muscles and see if we can get improvement. It may be a sleep appliance, which is a jaw repositioning device, and now also saying to them, okay, but I do see these certain muscle compensations if they're there, and if they're a candidate, we can talk about myofunctional therapy options. Or I'll look at a patient that comes back mild apnea, moderate apnea, and there's such crowding there's just no place for them to put their tongue. So that's why their mouth is open. Their tongue is above the teeth. We have an orthodontist who can intervene and see how much airway space can he create with airway orthodontics by moving and creating more space. It creates more tongue rest position. I could work on the muscles all day long with that patient, but if they don't have the room to put the tongue in the roof of their mouth, it ain't going to get them very far.
Right.
So not everybody's an ideal candidate for everything. It really is very customized and very much so based on what their needs are, what their their dysfunctions are. So there's, and it could be they can't breathe through their nose. They need to see an ENT. So collaborative care and just putting it all together. And that's just treating the airway and treating a symptom of, which is apnea is a symptom of the muscle dysfunction. But there are other things. There's the whole sleep hygiene. There's sleep routine. There's their diet, their exercise. It's becoming more and more, and that's something we also speak with the patients about.
Right.
Let's
Very
go through your
interesting.
routine.
Now, if someone gets a device, how long for the process? I assume they're customized. So
These are
how
very
long
customized.
do they get a temporary? What's the process?
So when a patient's coming to us for a sleep appliance, we're going to try and expedite that as quickly as possible, but we want to make them a quality appliance. So we're only going to partner with a lab that's going to deliver a quality appliance. And I wish I could say that's a quick turnaround time, but it's not. It's a specialty appliance. There's not all dental labs do this. There are exclusive labs that do this. So the average turnaround time could be 4 to 5 weeks. Some can get it done in 2 to 3 weeks. They are doing more and more of digital printing with appliances that
Yes.
come back quicker.
Yes, I keep hearing.
There's some of them are great, and some of them it's too new.
Right.
So we're going to decide which design would work best for the patient based on the evaluation, and then we'll get that designed for them. So for us, it might be a 4 to 5 week turnaround time. We do digital records now, so there's no impressions where, those adults that were traumatized as a kid with orthodontists with a tray full of goop in their mouth and they were crying and gagging on that.
That's a great thing to share. I didn't even realize we're doing that. That's great.
We as much as possible will do digital records.
That's great. And now, so I get an appliance, I go home. Do I come back?
Oh, absolutely.
Okay.
We're going to follow through. We're not just delivering, as Dr. Brown calls us all the time, I'm not delivering a piece of plastic to you. And it's the truth. We want to know, is this working for you? Remember, we can't see the airway when you're wearing an appliance. What we do need to do is move towards a point where we're seeing improvement in the symptoms and we're ready to retest that patient using our screening device while wearing the appliance. And that might mean that it's a series of tests over 2-3 nights over a 2-week period. We guide the patient through that. They're given a sleep log so that they can keep track of how they felt when they woke up, the comfort of the appliance, anything that happened during the night of sleep. And we may be testing different positions because an appliance is not one set position. It is something that you can readjust to bring the jaw forward more. So we want to know how far forward we need to go before that patient's airway is open. We want the minimum amount of movement forward, not to overstrain the muscles so that there's comfort and it's tolerable to achieve the results that we want. But we can't see that, so we have to test.
Gotcha. And if I was doing myofunctional therapy, where do we do that?
You can do that in the office with me. It's one-on-one therapy. We would have to do a full evaluation, full history, your sleep patterns, your history from infancy, childhood to adulthood, to track any patterns that you may have missed as being part of the overall treatment. And then we look at the muscle movement and the muscle function. And we check for basic function positions and restrictions. And then based on that, it also includes photos, specific photos. Based on that, I would build out a treatment plan to start working on first knowing what the basic movements need to be, and then building in the more complicated exercises.
Are these exercises done only when I come into the office, or are these things that
That
I do
is
both
a
at home?
great question. So, myofunctional therapy is completely compliance based. In order to get the results, you need to be practicing on your own in between sessions. So, basically, you would be given a set of exercises to do, and you need to practice them. It's not only when you're in the office and you can show me that you can do that while you're in front of me for that 30 minutes. It is, you need to be training those muscles to think and function differently to correct habits that you've been doing your whole life. So that means you might need to be practicing 2, 3 times a day. Very simple. You can practice, on your way to work in the car, in your downtime. These are small
I can
exercises.
do the no talking zone because I'm doing my
Absolutely,
exercises.
absolutely. Listen, if
Nice.
the person driving next to you sees you making weird faces, you're never going to see that person again. It's no
Gotcha.
worries, and I've
Gotcha.
been caught like every now and then when I was practicing during my training. I'm doing these exercises, and my husband like, "What's wrong with your face?" Nothing. I'm just doing my functional exercises
That's
because I
great.
had to learn them too. I had to develop the muscle tone. Believe me, it's like exercising a muscle. Like your muscles are sore, your lips sore, your tongue sore, your jaw, everything. You don't even realize it until you start doing these exercises. The difference that it makes, and
Interesting.
to the point where you get a more chiseled jaw, less of a chin here.
Ooh, I'm
Yeah,
gonna sign
I
up.
know, I know. I need to, like, all those ladies out there. I'm telling you, you don't need a lift.
That's a good one. That's a good. I feel like we can get Deb to market that for us real
Yeah, right.
easily. Open everything up to a new space. We
Uh-huh.
find those pictures.
Mhm.
Um,
Uh,
and how young? How
the younger generation already knows this. Remember, I was
the
talking about
the young
social
the
media.
younger generation already has more stuff in their face than I do.
Oh my gosh, this social media, this whole mewing and
What?
Mewing. It's a myofunctional therapy move. Basically, it's forming a suction to the roof of your mouth with your tongue. And
You always have the most random pieces of information.
I didn't know that it was mewing,
I thought you weren't on social media for this reason.
but I have to educate myself. I have to know. Now I'm more and more on social media because I have to be. But it's amazing to me. Like they're doing, like in classrooms, the teachers were like calling students out because they were mewing. It's a lip seal. It's a tongue seal. Seal to the roof of their mouth. Doing that, they realized they were getting more of a chiseled jaw. Hey, guess what? That's a myofunctional therapy basic move.
Oh my gosh, I
Yeah,
cannot.
yeah.
How young are we treating?
So this is behavior based. We're in our office. It's about 5 years and up, and that's only if they're ready. They have to be ready to do the exercises. To
But you
have
would show the parents how to
Oh,
do this.
absolutely.
Okay.
The parents are a big part of this
Hmm.
because they need to make sure that that is practiced regularly and that's part of the routine. So it's not only, okay, you drop the child off with me and I show them what they need to do and they go home and do it. The parent has to be an active part of this because they have to be encouraging the child to do these exercises and they have to know when they're done correctly because they might be raising their tongue, but they might not be raising their tongue to where they need to raise it to.
Oh,
So
interesting.
if I'm not looking, somebody else needs to be looking, especially for a young child. Proprioception, knowing where to go with the tongue, that's a big part of it. And sometimes they need help and they need guidance. So it's a commitment on my part to guide you and show up, but it's also on the patient, the parent's part to follow through the exercises and be committed to doing that so they see the progress that they want.
I love it. I love it. I didn't even any of this.
Oh,
I was so prepared. I got fancy note cards because I like my note cards, and we didn't even need it.
oh, I hope we did okay.
What else did we not talk about that because this is your world? What I really love though, I'm spiritual, but sitting here with you after going through and
Yeah.
watching you on your journey that because I remember that day you were like, I don't know where to go. And I remember Sally did connect you with some great doctors and a whole team.
I don't want to come out and say that, but I mean, that had to be the most amazing moment. One of the most powerful moments in my life was sitting in that car, not knowing how I was going to drive home. And Sally came outside, knocked on the window, and said,
My daughter will
my
help you.
daughter works at Sloan Kettering
Yeah.
on a breast surgeon's team. I'm going to get you in.
Yeah.
I was sitting in the car
amazing.
going, who do I go to? Because the pathologist that called me with the results was just like, all right, your next step is to call a breast surgeon.
Right. Because we have them
Oh,
on our Rolodex.
yeah.
But what's amazing now, hearing you talk about what you're creating in your department for patients, you're actually recreating that exact energy for your patients. I mean, you're bringing things to them that they would not have known. They might have one, thought about maybe what's bothering them or not, and then you're bringing it all to them. I mean, one of the things this past week, paying real close attention to myself, being on vacation, and realizing, are we really fully present? Do we know, like I'm waking up with extreme dry mouth. Before I said this in this meeting, in this interview, it's just an annoyance.
Right.
But honestly, it's really a really bad annoyance. Like it's really bothering me. It wakes me up thinking about it. Wakes me up a few times, and just because I haven't read something or it didn't pop on my social feed, I'm not addressing it. But when I was away, I was really thinking about, I'm 50 years old. I've made the decision to go on hormone replacement therapy, which is a step putting myself first and making sure that my physical and mental health are still in good shape. So what else do I need to do eating wise? Limiting the alcohol, all these things that I'm now doing. Heck, I'm even on the car rides home, not talking on the phone the whole ride, just to have moments of quiet. Yeah, so it just struck me, remembering your journey, what you went through, and the camaraderie of your whole team at that point coming around.
Yes.
While we weren't professionals that could help you in the exact space you were going into, we were there to walk with you. And now you're creating that exactly for patients of our practice. That, I mean, it has to be incredibly rewarding.
It's incredibly rewarding, and my journey has helped me be a better provider and show up in a different way. I've always shown up for my patients, but service and listening to their stories. I've been on the other side of it, where you don't know what to do, you don't know where to go, and you show up in a doctor's office and they treat you like an insurance card or a copay. And when I was looking for answers and treatment, and I had different consultations with different doctors, I'd walk into an office and I'd be greeted behind a glass window. You have a $60 copay today. Hi, my name's Michelle. I have breast cancer. I don't know what to do, but you want my $60 copay? Sure. So I don't want our patients to ever experience anything like that.
No, I mean, that's definitely been
Yeah.
the philosophy of the practice for many years. But
Yeah, it is.
It's
That's
really
why I like being a part of Babylon Dental Care. That's why I've been here for 15 years, because of that. The service to the patients and treating them like family, like they're people, and offering them options for.
And listen, we make errors.
Yeah.
Like I get these patient calls, and they're like, "Well, you did." Yes. Do you know how much billing we did? Like, yes, there's people that
No one's
I can't
perfect.
guarantee that everyone's gonna, drink Sunny D and show up happy. I mean, I had mothers who had to come in today and have their kid, we do take missteps sometimes in service. I seem to get those issues, but everyone's intention is never to misstep. And then when we hear it, I will tell you, and again, I was a dental consultant for years before stepping into this role. This organization, 100% from leadership, ownership down, everyone goes into the same mindset of what can we do to make this better?
Yeah.
Do you know how many times I send flowers to patients that I know are never coming back in? I do it because I really do appreciate that they had the courtesy to speak to me or a lead or an owner, tell us what we did wrong, honor themselves and say, look, we're not coming back. I'm fine with that. I just want them to get the dental care that they want with us or without us.
Right.
Just don't stop seeing the dentist because of us. That's the
Yeah.
only thing.
Yeah.
And I send them flowers thanking them because it's never easy. It's much easier to drop an F-bomb on social media
Yeah.
than to come forward and say, hey, this really was alarming, Jenn, and this is why we're going to part ways. I mean, but anyway, just it was
know.
a full circle moment talking to you because I really, I mean, you were always a provider like that, but I do think that you going through what you did gave you a greater presence
Yep.
on the platform that you now have,
Like I
which
said
is
earlier,
beautiful.
divine intervention. It led me on the path that I'm supposed to be on. and
Exactly.
where I am
I
right
love
now.
it. I love it.
You asked me a question before.
Yes.
What is it that we didn't mention that we need to speak
Yes.
more about?
Yes.
Mouth breathing, because you brought it up a couple of times. That is something that is not normal. If you're mouth breathing, that's a very stressful form of breathing. It is in the chest and the shoulders. It's
So
a
talk to me
rescue
about
breathing.
not normal because you hear this? This is November.
Noses are meant to
November.
breathe,
I'm
mouths are
still
meant to eat.
congested.
Yeah.
So when do we know it's beyond a cold or allergies and it's mouth breathing?
So chronic mouth breathing will create inflammation and congestion for you. Sometimes we need to make sure that there's no physical obstruction to being able to breathe through the nose and then work on correcting the mouth breathing to maintain lip seal and breathing exercises, tongue rest posture exercises to correct the body's safe fail, which is I'm just going to open my mouth and breathe. Patients that are breathing through their mouth all day long are exhausted. It's an exhausting way of breathing. It's stress breathing. It's like panting.
So you're
all day
talking
long.
all day long, and then night is something
At
different.
night.
At night.
Yeah, if they're doing it during the day, if they're doing it at night, your body at night, if you're mouth breathing, it's not creating that nitric oxide during the day. It's just not creating that nitric oxide. It's not bringing your body into a recovery mode. It's literally in stress mode. And that's another thing that our screener shows. It shows our different autonomic nervous systems, our rest and digest versus our fight or flight.
I want to, if I do that, don't tell me that screening. I don't want to know. My daughter has, everyone has the aura.
Yes.
Yeah.
The aura
She's
ring.
like, do you know how much stress I'm under? I'm like, really 22 years old. I'm paying for everything,
Right.
just graduated college and
Yep.
volunteer servicing, whatever you're doing.
Yeah.
Yes.
Mouth
that
breathing
stress,
creates the stress.
that stress is very high.
Yeah. And it stresses while you're sleeping.
Maybe she has a tongue tie. Maybe we need to get her
I
evaluated.
think so. Yeah. You need to come in.
That's
We need
great.
to do this.
I love it. I love it. I was just thinking too, we should talk about the breathing at our next staff meeting. And truthfully, at our next staff meeting, I think we should do 3 exercises with the staff.
Sure.
But let's get the doctors out of, they like to hide from me in the staff meeting. Let's put them right up front and have them do it first. And then let's go through seriously, let's go through some exercises at the next staff meeting because I think that's really important.
You mentioned our staff, and I would be remiss to not mention this pioneered testing for our staff that you put forth.
Oh, that's
with our
not
testing.
pioneering. That's just me being a pain in the ass.
Listen, you created a way with a new company that we were using to test our entire staff, screen our entire staff. It's
called marketing,
and
Michelle.
Give them all a patient experience. That was a learning moment for so many of those staff members who didn't realize what
Well, that
they
was,
were struggling
I
with.
had to keep looking at what's the gap. But, that's how I started in dental.
Yeah.
Because I hated the dentist growing up. It was, family friend,
Yeah.
smoking cigarettes, pulling teeth, drilling teeth in my mouth. It was like a nightmare. And, when Cliff was like, oh, don't go back to teaching, come market. I said, I don't want to market a dentist. I don't really like the dentist. He says, no, you're actually the perfect person to market a dentist because we create something different. Now go put the word out, you know?
You know, this has created something that if we're recommending to patient now, they say, I did this myself.
Well,
We took
yeah,
care of it.
it was very important that not only
Yes.
that, but I could kid about it all I want to, but the fact that I potentially have people that were suffering
Yes.
in our practice,
Yes.
not knowing,
They didn't know.
bothered me probably just equally as they didn't even know what the service was. So
We identified a lot of things that they weren't aware of, and we've gotten our staff members that were struggling we're getting them
I
into
love it.
treatment. We're
I'm
moving
glad
them
that
to
worked out,
diagnosing.
and
It worked out fantastic.
they all did really well with
But
it.
this is a practice what you preach, and we definitely did that. We screened everybody in the practice. We've done it ourselves.
I love
We
it.
know what the experience is like, and we can better walk that patient through what their expectations will be.
All right, we went on I'm probably going to get yelled at for going over, but
Oh gosh.
it was a great conversation. I mean, I learned a bit more. Every time I talk to you, I learn a bit more.
Well, thank you for having me. It was great to be able to share this on a platform
Yes.
where
Number 2.
I know this
Very
is
special.
incredible, getting information out there. You know, the more that we can get that out there, the more that patients are going to see this, and they're going to, you know, start putting the pieces of the puzzle together and like, oh my gosh, maybe I have that, or maybe I can use that. And, you know, I mean, we're here to help.
So before we close everything down, let's talk because it gets a little confusing. So we are Babylon Dental Care. We are a dental practice, but we have a side practice.
We have a specialty practice within our practice, Silent Night Therapy, Airway Health of Babylon Dental Care. So that is its own specialty within our practice, offering airway health services. So, you know, we have a unique perspective because we have a dental background, and now we have an airway health background. We have a sleep medicine background. So we could address many levels of service when patients come to see us.
Love it. And to make it even more confusing, the website is www.sleepbetterny.com.
Sleepbetterny.com. So you'll find us there. A lot of patients find us there.
A lot of great information is popping up. The marketing team's
Yes,
doing
a
excellent
lot.
getting the information up there in real
A
time.
lot of information, you know, and when you go on that website, you can actually take a survey as to what your symptoms are. And when you take that survey, we get that information. We reach out and, you know, call you up and say, hey, how can we help? What are you struggling with? And, you know, move you into coming into the office, having an evaluation, getting you treated.
Love it. Love it. Well, thank you for your time today.
Thank you for having me. It's been great.
Yes, I agree.